Raquel Hatulan, a first-year student nurse at Davao Doctors College. In this video, I will show you the assessment of the eyes. Before we proceed to anything, it is important to review the medical records of your patient because it will tell you where to focus the assessment. But in the case of my scenario, I don't have the medical records of my patient, so we are going to skip that part. As I have mentioned, I will be assessing the eyes. So in assessing the eyes, I will need several equipment. The equipment that I would need are, first, my millimeter ruler. Second is my jot down notebook. Third is the pen for taking down notes. Fourth is my pen light. Fifth is my opaque card. And the last one is my Snellen chart. Before any medical procedure, it is very important to perform hand washing to prevent the contamination of germs and the spreading of infections. Good morning, ma'am. My name is Raquel Hatulan, a first-year student nurse at Davao Doctors College. I will be assessing your eyes today. But before we do that, I would just like to confirm your identity to be sure that I have the right client today. Your name is Roxanne Torres. You are 19 years old. Your birth date is March 5, 2001. Okay. So, ma'am, how do you want me to call you or address you during the procedure?
You can come here.
Okay, Roxanne. As I have mentioned a while ago, I will be assessing your eyes. So during the procedure, I might ask you to do several positions and direct you to do it. Okay? So I will be inspecting your eyes to see if there are abnormalities using different equipment, and also I will test if your vision is still normal. Okay? So ma'am, during the procedure, before we proceed to the procedure, do you have questions or clarifications?
None.
Okay, ma'am. Also, ma'am, I want you to know that your privacy is protected. Everything that will happen during the procedure will remain confidential. I will only share this to other medical professionals that has something to do with your health, especially if we find something that is considered abnormal. Okay, ma'am? Okay, so I will just close the door to secure your comfortability. Is that okay? So I am doing this right now so that the patient will be free from distraction, and also this will assure the comfortability of the patient. Okay, so now I am going to check the visual acuity of my patient. So I am checking if she has visual aids. But as far as my inspection right now, I can't see any visual aids. So I'm just going to ask my patient to confirm it. Ma'am, do you wear visual aids or corrective lenses such as glasses or contact lenses?
None.
Okay. So coming from a patient, she doesn't wear corrective lenses or visual aids at all. But there are cases that patients wear visual aids. So if you are going to assess the visual acuity of your patient that wears visual aids, just let the patient wear it. Now we are going to use the Snellen chart to check the visual acuity of my patient. I will now ask her to stand 20 feet or 6 meters away from the Snellen chart. So my patient now is here with me and is ready for her visual acuity test using the Snellen chart. So I have my jot down notebook to record the assessment. Okay. Roxanne, I will cover your right eye first because we're going to assess the left eye first. And after that, I'm going to cover your left eye using my opaque card. And after those two, we're gonna assess both of your eyes. Okay? We're going to start. Okay, just read everything for me and, you know, just stop if you can't read the other letters anymore. Okay. Okay, can you hold this for me and cover your eyes? This is the left eye. Okay. Can you start? Yeah.
E F P T O Z L P E D. Oh my god. F N C F D. I can't na.
Okay. Okay, transfer it to your left eye. Yeah, okay. So now we're going to assess her right eye.
Okay. From the start.
Yes, from the start.
E F P T O Z L P E D F E C F D E D R C Z F R S T O F M N. N?
Okay. Now I will hold this so that you can use both of your eyes to read it.
Okay. E F E T O Z L P E D F E C F D E D F C Z F R N L R Z N.
Okay. Thank you so much. Now I'm going to proceed to performing the selected vision test. The first one is the light perception and the second one is the hand movements. I will no longer do the counting fingers because my patient was able to see the top line of the Snellen chart. I am going to do the hand movement first. You tell me where my hand is going. Okay? So, where do you think my hand is going? Okay.
Down.
Okay. So now I'm going to proceed to light perception. Okay, Roxanne, tell me where the light is coming from.
Up. Down. Right. Left.
So now we are going to test the visual field of my patient. As you can see, I am going to sit 2 to 3 feet away from my patient so that I can extend my arms properly as I wiggle my fingers. Okay, Roxanne, I want you to stare directly into my eyes so that you can move your neck or your face as I move my fingers around you. Okay? Once you identify my fingers, please tell me immediately. Okay? Okay, I'm gonna start now. Tell me if you see it already. Okay? Okay? Okay. How about this? Okay. 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 So as you can see, my patient has no defect at all. But I am going to show you how it's like to repeat the test when your patient has defect. So assuming that my patient has defect on her right eye, so I'm going to do it again. Okay? So this side is her right eye. So I'm going to move my fingers slowly. Okay. Okay. So that's how you do the visual field test. Okay, so now we are in the visual inspection of her eyes. I am visually inspecting her eyes to see the alignment and the symmetry of her external features. So just like for her eyebrows, I am going to look at her eye distribution and also the alignment and the skin quality. Okay, can you please raise your eyebrows for me? Raise your eyebrows. Okay, can you lower it down? Okay. Okay. After the eyebrows, I am going to inspect her eyelashes to see if the direction of the hair is in the right direction. I am looking at it if it is curved outward the eyes and not curved towards the inside of her eyes. So as I can see, it is curved outward the eyes, and that is normal. Okay, so we are now inspecting her eyelids. We are looking at the surface characteristics, the position in relation to the cornea, and her blinking capacity. Ma'am, can you blink for me? Okay, in blinking, a normal blinking range is 15 to 20 blinks in 1 minute. Okay, so I'm going to inspect her lacrimal gland and lacrimal sac if there is swelling. Okay, ma'am, please look up for me. Okay, so I use my thumb to inspect her sclera and also her bulbar conjunctiva. Okay, now ma'am, I want you to close your eyes. Close your eyes because I'm doing this to assess her palpebral conjunctiva. Okay. Ma'am, please open your eyes again and please look directly at me. Okay? So as she was looking directly at me, I was inspecting her pupils and also her iris if there are abnormalities. Okay? Okay, Roxanne, I am going to proceed to inspecting your cornea and lens now. Please don't be shocked as I am going to use my equipment, which is the pen light. Okay? As I will do this, just look directly at me and don't move your head or your vision. Okay? Just look straight at me. I am doing this to inspect the opacity and the texture of the patient's cornea and lens. Okay. Yes. So now I am going to proceed to the assessment of her direct and consensual pupillary reaction to light. So for this one, I will assess her direct and consensual pupillary reaction to light to see how her pupil constrict and dilate. But before that, I have to darken the room. So I already turned off the light. Okay? So since I have already turned off the light, I will now use my pen light to observe her pupils. Okay, ma'am, I am just going to use this po.
Hindi na, camera rin.
So now I am going to assess the pupil's reaction to accommodation. We are doing this to determine the function of the third cranial nerves. Roxanne, I am going to hold the pen light 10 centimeter away from the bridge of your nose. Okay? Just observe the pen and don't look at other things. So I will observe your reaction po, ma'am. At first, ma'am, please look at the ball pen. And after looking at the ball pen, please look at a distant object. Like the wall po, ma'am. The wall behind me. Okay? Please do what I do. Okay? What I ask you to do. Okay? Please look at the ball pen. Look at the wall. Look at the ball pen. Look at the wall. Look at the ball pen. And look at the wall. Okay, good. Okay, so now, ma'am, I am going to move the ball pen near your nose, near the bridge of your nose. So please observe it. Please follow the movement of the ball pen as I push it towards your nose. Okay, 1, 2, 3. Okay, thank you, ma'am. So now, I will perform the Hirschberg test to my patient. We do this procedure to detect strabismus. So, I am going to stand 2 feet away from my patient. And while doing the procedure, I will inspect the reflection on her cornea, and also I will observe the direct and consensual reaction. Okay, so I am now 2 feet away from my patient, and I will observe if the eyes are equally receiving the light from the pen light. So now we proceed to the extraocular muscle test. We are doing this to determine eye alignment and coordination. So as you can see, my patient is still standing, and I'm still gonna stand 2 to 3 feet away from her. Okay, ma'am? Um, just ano po, just look directly on the just look directly sa ball pen po. And I am going to draw a letter H and just follow wherever the ball pen goes. Okay, ma'am? Okay. Ayos lang po mag-move, ma'am, ha? Okay, move ang head. So now we are in the summary and closing phase of our eye assessment. Okay, so now ma'am, I am going to summarize all the things that I've gathered during our eye assessment. For your visual acuity, I have here, when we use the Snellen chart, I have recorded that for your left eye, it is 20/40 with correction. For your right eye, it is 20/30 with correction, and also for your both eyes, it also have its correction, but it is 20/25. And when we tested your visual fields, you have a normal finding because you can see the objects on the periphery. And we did not detect a defect while we were doing the visual fields test. And also, for the visual inspection of the eyes, there were no discharges, no infection, and no discolorations were observed on the external surfaces of your eye. Your blinking was normal because it was 15 to 20 blinks per minute. And your lids closed symmetrically when opened. Also, there were no visible sclera above. There was also no edema of the lacrimal gland. And for the part of assessing direct and consensual papillary reaction to light, your illuminated pupil constricts, and also the non-illuminated pupil constricts. So this is normal because both eyes should constrict at the same time. Okay? So for the assessment of your accommodation and the convergence test, it showed that your pupils equally round and react to light and accommodation. So during the Hirschberg test, so far your Hirschberg test, you have normal corneal reflex. And for the cardinal fields of gaze test, I a while ago I told you that it was the extraocular muscle test. So from that test we got that both eyes coordinate. Okay? So so if you have concerns, it would be best that you go to medical professionals so that they can easily detect if there are further problems. So ma'am, Roxanne, do you understand that most of your physical assessment, most of your results from the eyes assessment today is normal, But my only problem is your visual acuity, since it was hard for you to read some letters from the Snellen chart. Although it's still okay because you're not wearing visual aids, okay? But if it gets worse someday, or in the near future, of course, you know what to do. You go to a medical professional. Okay? So, do you have any concern or questions about the medical procedure today? Okay. Thank you so much. Thank you for participating and for doing what I asked you to do, and also for being honest during the whole procedure. I will now write my observations and the result of the eye assessment to the comprehensive health form for the eyes. This will serve as one of the medical records of my patient.